Dr. Mark Gittleman. I'm a breast surgeon working at Coordinated Health at the 250 Citronia Road campus. I've always had an interest in biology and science. No one in my family is in medicine, so I'm really the first one, but I've always had an interest in that ever since I was a kid. And when I was in high school, I used to work at the hospitals as an orderly, so I got into the hospital environment, used to follow the doctors around, kind of liked what I saw, and I just gravitated into that area. Well, I graduated from Franklin and Marshall College and then went to medical school at the University of Pennsylvania in Philadelphia and did my surgical internship and residency at the hospital of the University of Pennsylvania. When I finished my training in the mid-70s, I was in the Air Force for 5 years as an Air Force surgeon. Following that, I came to Allentown in 1979 and I was in a general surgery practice. I had an interest in breast surgery and breast cancer. A number of my family members had been unfortunate enough to have breast cancer. That was one of the reasons. And also some of my mentors in my residency program had an interest in breast cancer and breast cancer surgery. I found the science fascinating, the surgery quite interesting, and the ability to help women with this malady. As far as what we actually provide services to our patients is not just doing breast surgery, but it's rather making the diagnosis of breast conditions which may or may not lead to having breast surgery done. In other words, we see patients commonly for breast masses, breast lumps, breast pain, or abnormal mammograms or other imaging studies of the breast. That's why the patients come to see us. But we don't just receive patients after they've had a diagnosis of breast cancer made elsewhere for treatment. We actually make the diagnosis and also provide the treatment. The reason I chose to join Coordinated Health as opposed to other regional healthcare providers was the philosophy and the ability to get things done in an efficient, quick manner without having a lot of overlays of bureaucracy and so on. I think patients, of course, have a choice of where they go for their breast care. I've been in practice now for more than 30 years here in Allentown and a few years before that when I was in the Air Force. So I bring to Coordinated Health and I bring to the patients that we serve my experience and my training and my deep interest in breast care and breast cancer surgery. But my other interests are in teaching and in doing some of the research and consulting with industry folks about new products, new diagnostic tests, and so on. And the other research we do is with the national cooperative groups such as the NSABP or ECOG, the American College of Surgeons Oncology Group research trials, and so on. So we're very much interested in doing research because we know it leads to better treatment for our patients in the future. The most common condition we see patients for is their fear of having breast cancer. In other words, a patient comes in with a breast lump or an abnormal mammogram or breast pain or discharge from the breast nipple area and so on. These are the complaints we see patients for. So the most common conditions we see are actually benign breast disorders, but within that mix, of course, we see patients who are newly diagnosed or yet to be diagnosed with breast cancer. We actually see men in our practice too with breast abnormalities. Men have breast pain, they have breast masses, and men actually develop breast cancer too. In our practice, we see about 200 or 200 plus new breast cancer cases every year, and actually it pans out in that we see 1 to 2 male breast cancer patients every year. That's that 1%. As far as advice I'd give to women about taking care of their breast health, it's important that they recognize that there are certain risk factors that they have or they don't know that they have, which should be assessed. So basically, women should be having a physical examination of the breast by a healthcare provider annually, either by their primary care, their GYN doctor, or by us, but also starting having mammograms at age 40 and every year thereafter. There are certain exceptions to that. Women would start having mammograms earlier if they have very high risk factors, strong family history, and so on. But basically, that's what women should do. Have an annual examination by a healthcare provider and annual mammography starting at age 40. At the facility at 250 Citronia Road, Coordinated Health also has newly acquired the breast imaging facility called Advanced Imaging for Breast and Body, which is housed in the same facility as my office is. At that facility, we have all of the tools that we need to help in the diagnosis of breast conditions. We have some equipment that is unique to this facility, such as PET mammography, or PEM, which is a nuclear imaging of the breast. We also provide breast MRI, digital mammography, breast ultrasound, PET CT scanning, and likewise, in addition to those diagnostic modalities, we also have a treatment center in the imaging center where we treat patients with breast cancer with partial breast radiation. The thing that drives me to do what I do every day and get up in the morning is because I'm intensely interested in what I do and taking care of our patients, talking with our patients, doing the surgery. I find it technically very gratifying and also personally very gratifying to talk to our patients about what's going on, how we can help them. And so I enjoy that part, and I look forward to doing that on a daily basis, in addition to working with my colleagues on some of our research and our educational efforts. So that's what, it's fun. Every day I get up thinking, this is going to be a good day, and that's why I go to work every day thinking this is going to be fun. A patient said to me one time, "Gosh, Dr. Gittleman, when are you going to retire someday and enjoy life?" And I said, well, I'm enjoying life right now. What I'm doing is not that I have to retire to enjoy things. I enjoy what I'm doing, or else I wouldn't be doing it.